Here, you can be your best. The best train here. Learn here. Succeed here. Perform here. Win here. Thrive here. Itawamba Community College. The best start here.
Why settle for a checking account that just holds your money? Renaissance Rewards Extra gives you so much more. Like savings at more than 400,000 retailers, 24/7 roadside assistance, a cell phone protection plan worth up to $400, $25 in ATM fee refunds per monthly cycle, and a great interest rate when you meet 3 easy qualifications. Get extra today at rewardsextra.com. Renaissance Bank, understanding you. Member FDIC.
High school seniors, make your plan to join us for Fall Preview Day at Itawamba Community College. Voted the #1 community college in the state 4 years in a row, come see what all ICC has to offer you and your future from faculty members within the program of your interest. Registration is open now for October the 21st and 22nd and November the 4th and 12th. Limited spots are available and they're filling up fast, so sign up today at iccms.edu/preview days. Itawamba Community College, the best start here. Good afternoon and welcome to another edition of the ICC Hour here on Super Talk Mississippi. I'm Adam Gore, the Sports Information Director and Director of Media Relations here at Itawamba Community College. And as always, I greatly appreciate you guys taking time out of your Tuesday afternoon to join us here for the show. And as always, the ICC Hour is being presented to you by our friends at Renaissance Bank.
Ooh, fumble. Let's give her a Renaissance replay. Make the right call with Renaissance and get cell phone protection with Renaissance Rewards Extra Checking. Sign up today.
On this week's show, we'll talk with Dr. Mary Linda Moss, who is a breast imaging radiologist with the Breast Care Center at the North Mississippi Medical Center in Tupelo. With it being Breast Cancer Awareness Month, Dr. Moss will tell us more about the importance of routine exams, some of the advancements that they have in place at the Breast Care Center. She'll also talk about what groups of individuals that may be at a higher risk to be diagnosed with breast cancer, and she'll have a lot more great information that you'll want to stick around for in our first 2 segments of the show. Then later on in the show, we'll preview some of our special offerings here at ICC, including our Food Pathway Program, our Early Childhood Development Program, and our Forestry Program as well. Now, if you or someone you know would like to get more information on classes or some of the programs we have to offer here at ICC, I encourage you to visit iccms.edu. That's iccms.edu to learn how ICC can help prepare you for a better tomorrow. We're going to step away and hear a word or two from our sponsors, including our presenting sponsor, Renaissance Bank. And when we come back, we'll talk with Dr. Mary Linda Moss here on the ICC Hour.
Playing on tour takes years of dedication, hours of practice, focused precision, and nerves of steel. That's how you become great at the game, but not how you should bank. That's why Allie Ewing chose Renaissance Bank. Their easy-to-use app makes banking a breeze, no matter where she is. Renaissance Bank, understanding you.
Everyone has a unique story to tell. Maybe your story has you performing your new song in front of a crowd, getting to play your favorite sport, or enjoying a horseback ride in the country. At Orthopedic Institute of North Mississippi, our group of skilled surgeons understand your need to continue your story. That is why we are the preferred choice for orthopedic care. Thank you for choosing us. Our story is you. Orthopedic Institute of North Mississippi.
Ever since we opened our doors in 1964, Davis Ford in Fulton has been committed to providing the highest level of customer service and customer satisfaction. That level of commitment is shown in our 18 Ford President's Awards for overall customer experience. Whether you're looking for a tune-up, a trade-in, or a new F-150, the team at Davis Ford is here to serve you. Come see us today in Fulton. Call us at 662-862-3711 or visit us online at davisfordsales.com. Davis Ford, small-town dealership, small-town prices.
High school seniors, make your plan to join us for Fall Preview Day at Itawamba Community College. Voted the #1 community college in the state 4 years in a row, come see what all ICC has to offer you and your future from faculty members within the program of your interest. Registration is open now for October the 21st and 22nd and November the 4th and 12th. Limited spots are available and they're filling up fast, so sign up today at iccms.edu/preview days. Itawamba Community College, the best start here.
They used to call me Sir Sauce back in the day.
I knew you was going to claim
Sir
that.
Sauce a lot.
You know,
Will is the sauciest.
sauciest guy they know. Well, when I used to
kinda
date your
saucy at
auntie,
times.
she said I was saucy.
Sonic Crave Cheeseburger. You a saucy cat, man.
If I crave something, I have to have it.
So what are you craving? Like, what do you crave?
Attention, apparently. Look at him all sitting in the middle.
I know, right? It is really awkward. You just chose to sit there.
Sonic Crave Cheeseburger.
They say Diet Coke is a mom's drink. Well, you copied her jeans, her spin, her shoes, her scrunchie, and whether you realize it or not, her music. Now, copy her drink. Drink what your mama gave you.
Hey, honey, could you help me with this? Today tastes like staying in. And it never tasted this good.
Why settle for a checking account that just holds your money? Renaissance Rewards Extra gives you so much more. Like savings at more than 400,000 retailers, 24/7 roadside assistance, a cell phone protection plan worth up to $400, $25 in ATM fee refunds per monthly cycle, and a great interest rate when you meet 3 easy qualifications. Get extra today at rewardsextra.com. Renaissance Bank, understanding you. Member FDIC.
And welcome back to the ICC Hour here on Super Talk Mississippi 101.9 FM. And as always, the ICC Hour is being brought to you by our friends at Renaissance Bank. Renaissance Bank, the bank that understands you. Visit renaissancebank.com for more information. Well, October is Breast Cancer Awareness Month, and that's one thing that we're going to focus on the show today. And I want to welcome in our guest, Dr. Mary Linda Moss. Dr. Moss, how are you doing today?
I'm doing great. Thank you for having me.
Well, first off, let me thank you for coming on the show. I know you have a very busy schedule, so we'll kind of just jump right into it. Kind of tell everybody who you are, where you work, and just a little bit about yourself.
Okay. So I am with the Premier Radiology Group here in Tupelo, and I'm the imaging director of the Breast Care Center, which is, associated with North Mississippi Health Systems. And I have been here for about 4 years. Before that time, I was in Jackson, Mississippi, where I worked at Women's and River Oaks Hospital and did a lot of breast imaging there as well. But I've been here for about 4 years, as I said, and have thoroughly enjoyed Tupelo. This is a great place to work. We have some just really caring, sweet techs and nurses, and it's been a pleasure. It's definitely a step up to come here and get to work with all of these wonderful women and see these. We have fabulous patients, and it's been good.
Absolutely. Well, unfortunately, one in 8 women will be diagnosed in their lifetime with breast cancer, and that's kind of an alarming number, because if you think about just how many people are around in a day, and you can look around, say in your office or maybe even in your household or your social group, it's going to affect you one way or the other if it hasn't already. So just kind of talk about the prevalence of breast cancer.
Sure. So you're correct. 1 in 8. The latest numbers suggest that it may even be as prevalent as 1 in 7.
Oh, wow.
Women will get cancer in their lifetime. It is the most common cancer in women. Approximately 40,000 women die from breast cancer every year. 40,000 is a lot.
It is.
Another interesting fact is something that I think is important to realize, that, you think about breast cancer and you think the little, 75, 80-year-olds that get breast cancer or whatever, but 1 in 6 breast cancers are found in women between the ages of 40 to 49. We've also seen it in patients as young as 19 here. And so it is, it does tend to strike basically almost any age group. Mm-hmm. Another thing that I think is important is just by the fact that you're a woman, you're already at average risk for developing breast cancer. And what I mean by that is there's really not anybody who has a low risk.
Right.
Till 3 years ago, I had no family history of breast cancer, and my mother passed away from breast cancer in April of this year.
Mm-hmm.
And so, 75+% of all breast cancers are not genetic.
Really?
So a lot of people tend to take this false security in the fact that they don't have anybody in their family who had breast cancer, so their risk is probably low. But in actuality, that's false. Certainly, if you have a genetic predisposition, your risk is going to be higher.
Right.
But the fact that you don't have one does not mean, well, I don't have to go get a mammogram this year. I mean, nobody in my family has breast cancer. Everything's cool. I'm good. It can turn on a dime, number one, and you suddenly do have somebody in your family who has breast cancer, and I can attest to that. But you also, it doesn't matter. You're still, you're at least at just medium risk if you're female.
Yeah. And, that was one of the first things I wanted to talk about was some of those risk factors, and you talked about it there as well. So, so it could be genetics. It could not be genetics. So really and truly, it's like any cancer. It's just, it doesn't have any things that's like, okay, this is the type of people I'm going after. It could be anybody.
Right. Well, much of breast cancer is mediated, or its development is driven by the female sex hormones. And so anything that either increases the amount of those hormones or increases the time at which you're exposed to them is going to increase your risk as a female. It's not necessarily a modifiable or a changeable risk, but if you start menarche, at a really early age, or if you don't have any children, when you're pregnant, some of that stimulation then ceases. And so the earlier you have a child, that does lower your risk a little bit. The more children you have, lowers your risk a little bit. If a woman enters into menopause at a much later age than most, then her risk is going to be higher. And that's because that monthly variation of the female sex hormones does increase your risk. We talked about, some genetic risks. There are some interesting, for some reason, if you have an early growth spurt, and taller women have been shown in multiple research studies to have a higher risk of breast cancer, which, who knows how much higher risk, but they've just seen it more frequently in those patients. But there are a lot of modifiable risk factors that I think are important for people to know. And the number one modifiable or changeable risk factor is obesity, or an elevated BMI, or body mass index. It's now known to be a major risk factor for breast cancer, and studies have shown that by maintaining a healthy weight, and particularly with regular exercise, you can lower your risk significantly. Smoking, excess alcohol consumption, vitamin D3 deficiency, and some hormone therapies. Research kind of goes back and forth on whether or not birth control increases breast cancer risk. We think it does, but the degree to which it does, we're not exactly sure. And, then as women get through menopause and want to have some exogenous estrogen or progesterone to control some of those symptoms, there is some associated risk, especially with the non-bioidentical, the pharmaceutical grade estrogen and progesterone. But, I think one takeaway is, just like with any other cancer, not leading a sedentary lifestyle, trying to control your BMI, those things definitely, they cut down on the amount of inflammation in the body. And inflammation, we know, is linked to cancer and other disease development. I don't know very many oncologists who don't exercise regularly. I mean, they've seen it, they know it, and they take it seriously. And so, for the rest of us, that's a message we would like to get out, is the importance of trying to cut down on that inflammation. And a great way to do that is to, have a normal body mass index, and to, spend that time on the treadmill or outside walking, or, however you choose to get your exercise, but just to really, focus on being healthy and doing everything you can do. And then, that doesn't guarantee, obviously, but anything we can do to lower our risk, given that it's such a prevalent disease, that it is just so common.
Absolutely. And we're talking with Dr. Mary Linda Moss, breast imaging radiologist with the Breast Care Center, which is located on the North Mississippi Medical Center campus in Tupelo. A lot of great information there. So one of the things is education, as you said, you want to be able to educate yourself, know that you can exercise to help, how to help prevent these. But let's talk about detection and how important it is to, know what to do, that early detection and things like that.
Sure. Well, so the basic screening test, the kind of gold standard for breast cancer, is mammography. It uses low dose x-rays to detect an abnormality within the breast. And mammograms can't detect every cancer, and they can sometimes detect tissue that looks like cancer but is not. The more classic or 2D sort of mammogram that has been around for a while takes a view from the top to the bottom. We compress the breast, and the reason we do the compression, though it sounds like some sort of archaic, we just want to cause pain,
right,
but it's not. The reason we compress the breast is to really spread that tissue out, because with a 2D mammogram in particular, you're taking an image from the top of the breast all the way through the bottom of the breast, going from your head towards your feet. And that's one plane. That's and anything that's on top of each other, it's not going to be separated. It's just going to look like either a bigger mass, or it may just hide things completely. And we also do one kind of a side-to-side view, again, compressing the breast. And we try to put those two views together and in our minds sort of 3D orient where an abnormality might be. But we have newer technology now that is called tomosynthesis, which is more of a 3D type mammogram. And what it does is, instead of just taking two views, we do compress the breast in both of those planes, but then the tube in an arc moves over the patient and takes multiple images at different projections. And then those images are reconstructed with a computer algorithm. And it's almost like it's giving you thin slices through the breast by the time the computer finishes reconstructing it. So instead of having just really 4 pictures, 2 of each breast to look at, we have hundreds of pictures that allow us, better spatial orientation, but it allows for better separation of things within the breast so that masses are a little easier to see. And benign things, it's a little easier to tell that some things are not going to be a cancer. So it, in theory, will significantly increase our cancer detection rate, but it also should decrease that number that is called a callback rate. And it's the number of patients from a screening mammogram that we have to call back in for additional imaging. That's, associated with significant fear and anxiety. And so we try to do that as little as possible. But if we don't call back some patients that we think are normal, sometimes we're fooled and we see something that we think is probably okay. We call it back and it ends up being a breast cancer. A lot of the time we call something that looks almost identical to that back and it's benign. And, about 10% of all patients will have a callback, on any given day from the screening mammograms that they've had. And so what I'd love to do is try to alleviate some of the fear and the anxiety that patients feel when they get called back, because of that 10%, only 2% will probably go on even to have a biopsy, and less than that will actually have a breast cancer. And that's because as a screening test, you have a big group of patients. You're trying to narrow that down to the more suspicious ones. And then from there, you determine which ones have actually, a significant chance of having breast cancer, and which ones are like, nope, you were fine. That was just some tissue overlapping, or, one of the other many benign, possibilities.
Absolutely. I know that's your favorite part, is whenever you're able to tell a person that that's the way it is there.
Why settle for a checking account that just holds your money? Renaissance Rewards Extra gives you so much more. Like savings at more than 400,000 retailers, 24/7 roadside assistance, a cell phone protection plan worth up to $400, $25 in ATM fee refunds per monthly cycle, and a great interest rate when you meet 3 easy qualifications. Get extra today at rewardsextra.com. Renaissance Bank, understanding you. Member FDIC.
High school seniors, make your plan to join us for Fall Preview Day at Itawamba Community College. Voted the #1 community college in the state 4 years in a row, come see what all ICC has to offer you and your future from faculty members within the program of your interest. Registration is open now for October the 21st and 22nd and November the 4th and 12th. Limited spots are available and they're filling up fast, so sign up today at iccms.edu/preview days. Itawamba Community College, the best start here.
Look at this new crazy calzone from those brainiacs at Little Caesars. It's a pepperoni pizza surrounded by a calzone crust. Little Caesars got us again.
Is it more pizza or more calzone?
I don't know. What do you think, Pizza Bot?
Pizza, calzone, both. Confused. Pizza, calzone, both. Tell my wife. Bleep bloop.
Oh, we're not Big Pizza, we're Little Caesars, the new crazy calzone for $8.49.
Pizza.
Ever since we opened our doors in 1964, Davis Ford in Fulton has been committed to providing the highest level of customer service and customer satisfaction. That level of commitment is shown in our 18 Ford President's Awards for overall customer experience. Whether you're looking for a tune-up, a trade-in, or a new F-150, the team at Davis Ford is here to serve you. Come see us today in Fulton. Call us at 662-862-3711 or visit us online at davisfordsales.com. Davis Ford, small town dealership, small town prices.
Everyone has a unique story to tell. Maybe your story has you performing your new song in front of a crowd, getting to play your favorite sport, or enjoying a horseback ride in the country. At Orthopedic Institute of North Mississippi, our group of skilled surgeons understand your need to continue your story. That is why we are the preferred choice for orthopedic care. Thank you for choosing us. Our story is you. Orthopedic Institute of North Mississippi.
In Searcy, Arkansas, a young man says I love you for the first time, but his girlfriend doesn't quite hear. In Franklin, Tennessee, a boy encounters his first pickle. And in Kyle, Texas, after a mission for tots, cousins realize they're a long way from Kyle, Texas. One day, many people, millions of orders. This is Howie Sonic.
Playing on tour takes years of dedication, hours of practice, focused precision, and nerves of steel. That's how you become great at the game, but not how you should bank. That's why Allie Ewing chose Renaissance Bank. Their easy-to-use app makes banking a breeze, no matter where she is. Renaissance Bank, understanding you.
Welcome back to the ICC Hour presented by our friends over at Renaissance Bank. They are the bank that understands you. And before we get back to our conversation with Dr. Moss, I want to remind you that ICC is offering an opportunity to assist prospective students with their completion of the free application of federal student aid, also known as FAFSA. Students in the ICC 5-county district can make appointments with a financial aid advisor on a designated dates, and we'll talk about those in a second, to get help them fill out that information. The schedule includes today at Morville High School, Tupelo's Christian Prep School, TCPS, tomorrow, and then on October the 28th, they'll be at Shannon High School. On October the 29th, it'll be Itawamba AHS, Aberdeen High School on November the 2nd, Hamilton High School on November the 3rd. They'll be at Amory on November the 8th, Tupelo High School on November the 9th, Okolona High School November the 10th, Pontotoc High School on November the 11th, South Pontotoc High School on November the 16th. Additional sessions have been held at Saltillo, Smithville, Hulka, Hatley, Nettleton, Baldwin, Tremont, and North Pontotoc. A great job by our financial aid department going the extra mile to help these kids fill out the forms that they need to fill out to get some federal aid for college. Now, if you or somebody you know needs to set up an appointment that's inside our 5-county district, they can be scheduled at iccms.edu/appointments. That's iccms.edu/appointments. The FAFSA is a form used by the United States Department of Education to determine eligibility for federal, state, and college-sponsored financial aid, things like grants, educational loans, and work-study programs. For more information, call 662-862-8200. That's 662-862-8200. Or you can email FINAID, that's FINAID, at iccms.edu. That's FINAID at iccms.edu. Now back to our conversation with Dr. Mary Linda Moss here on the ICC Hour presented by Renaissance Bank. Now let's talk about like self-exams. How can they, maybe get early detection through self-exams?
Well, and that's, early detection, the key to early detection is that it's going to decrease the breast cancer death rate, and it also means that treatment can possibly be minimized as opposed to much later detection where treatment has got to be much more excessive and much more difficult. Self-exams are important, but, they're really only going to help you. A lesion has to be decent sized typically before you can detect it with a self-breast exam. But if you are good about doing your self-exam every month, even patients who have, what they refer to as sort of lumpy bumpy, I don't even know what I'm feeling, help me, it doesn't do me any good to examine myself. If you do an exam every month, eventually you become aware of what's normal for you and what's not. And so an abnormal finding sticks out to you a little bit better. So it is important to do that every month, even if you have the lumpy, bumpy, difficult to examine breast, because you can become really accustomed to what your breast tissue feels like and then detect an abnormality earlier. I would not, go to self-exam and think that that's going to be enough, just because typically by the time it's palpable, it's pretty sizable. Right. We also have ultrasound, and in some of our younger patients, that's where we start because there's no ionizing radiation associated with ultrasound. And it's a good tool when there is an abnormality. There are some screening ultrasound exams that are available that we hope to have here soon. But it's a whole breast ultrasound kind of thing that is a great tool, and hopefully we'll have that here. But really right now, ultrasound is really more used in the diagnostic setting, meaning there's an abnormality, whether it's a palpable concern or there's breast pain, or there's a finding on mammography and we want to evaluate it further with ultrasound. So, that's another tool we have. Breast MRI is a tool that we use not infrequently. It's a great tool. It has a 98% sensitivity, which means if you have a negative breast MRI, you have a less than 2% chance of having any sort of missed cancer. And the numbers are not that good with ultrasound or mammogram. They're good, but they're not that good. If you have really dense breasts, mammograms are going to detect about 60 to 70% of breast cancers in somebody that's got that classic really dense breast tissue. If you've got more fatty replaced breast tissue, mammograms are going to detect, upwards of 90% of all of them, maybe closer to 95. So it's variable based on the way your breast tissue is made. But the combination of factors and that consistency, if you're going somewhere to have your mammogram, either stay at that place and continue to go so that they have previous year's mammograms to compare with, because sometimes the only difference, the only sign of a breast cancer is just a subtle change. Mm-hmm. So either stay at that place, or if you want to change to a place, you want to come see us, for instance, be sure to bring your old films with you or have them sent to us so that we can then get all of your films loaded into our PACS system and compare, not just this year with one before, but we try to compare with several years prior so that we can detect any subtle changes and get moving on those.
Okay. And it sounds like to me consistency is a big key in it. One, consistency with yourself, consistency with your doctor in that sense. So, I think that's a lot of great information there. So let's talk about, you touch on it for a minute, the monthly self-exams or, talk about that age group, how often they need to be screened, how, at what age do you need to start maybe taking a little bit more serious in those sense?
Sure. So there are multiple schools of thought out there right now about when to start screening, how frequently to screen. The American College of Radiology and the American College of Surgeons both agree, and I strongly believe that breast cancer screening should begin in average risk women should begin at the age of 40, and it should be annual, until, and the end point is, sometimes obviously people pass away and that's your end point. But as we see an older and older population of patients, we do mammograms on patients into their 90s. I think when the life expectancy is less than 5 to 10 years, at that point, it's not likely that a breast cancer that you develop at that point is going to be the thing that gets you when it's, only detectable by mammography. So, that kind of is a discussion to have with your referring physician as far as at what point do you stop. But at what point you start, I would say average risk, no family history, no genetic factors, not significantly overweight. I think 40 is the time to start. Now, there are certain Jewish populations, African American populations who have a little bit higher risk. And at the very least, they need to start screening at 40, but it's advisable to have a risk assessment at the age of 30. And that's with your primary care physician, your OBGYN. They can help you establish what your risk is and when you should start. If you have a family member, for instance, who, say your mother developed breast cancer at 35, then you want to start screening at least 5 years prior to the date at which your closest family member developed breast cancer. So, in those particular patients, they need to start earlier.
Mm-hmm.
But your average risk is to start at 40. You want to do your breast self-exam every month, see your physician every year, and then have your mammogram every year. And a lot of times the, mammogram will coincide with that, gynecology visit just to keep things, in order. But I think those are the primary and the most commonly accepted screening recommendations right now.
Okay. Now, when you talk about mammograms and things like that, can they do those locally? Of course, I told you I didn't know a lot about this coming in there, so I feel like this might be a great way to educate other people in my shoes. Do they need to set up an appointment through you guys, or what do you need to do on that?
Yeah, so we do take unreferred patients, but most of our patients come from, primary care, from gynecology. We have surgeons who send us, a lot of patients, and just in their routine visits, the patient's routine visits with their physician, usually they will check to make sure that they've had their mammogram in the past year, and if not, they can schedule that here with us. Our outlying facilities also have that new tomosynthesis, that 3D mammography. All of them have recently gotten brand new state-of-the-art 3D tomography units, and so that includes Pontotoc and Amory and Eupora and Iuka. And I hate to start naming because I'm going to miss somebody, but Hamilton and West Point. I mean, all of our outliers now have the ability to do tomosynthesis, which is just a better mammogram. Is basically that's the breakdown on it.
That's awesome. Well, we live in a COVID world, unfortunately, and that's one thing that maybe somebody is thinking, well, I don't want to go where there's a lot of people, and have a chance to be exposed to COVID in that situation. What are some of the steps that you guys are doing to help reinsure what's already a stressful situation, that they can come in a little less stressed, knowing that they don't have to worry about that side of things?
Right. Well, so first of all, there is the masking that's mandatory in the building, and we typically do not allow guests of patients to come in, just to cut down on the number of people that you're exposed to. We will try to follow the 6 feet separation sort of thing, except during the actual procedure. But the technologists are obviously going to have masks on. We ask that the patients wear masks, frequent hand washing. We are just trying to do anything that we can to minimize that risk. And we really have, patients have been very cooperative. We've, really not had any issues regarding that. They, we of course did not do mammograms at the height of COVID. We didn't do any screening studies. We just did, the workups for an abnormality. And, but now that things have leveled off some, we're not back to business as normal, but we are, taking those standard precautions just to be sure that there's no increased risk encountered to get this vital screening study performed.
Absolutely. And as you said, very vital there. We're talking with Dr. Mary Lindy Moss, Breast Cancer Awareness Month here. And she's shared a lot of great information. This will be available. If you want to go back and listen to this interview, you just search the ICC Hour on YouTube. Dr. Moss, let me ask you something. And this is, mental health is becoming something that's a lot more in focus than it has been in the past. Do you guys offer, like, say, support groups for people that have been, that have breast cancer, or anything like that over there on the Tupelo campus?
That's a great question. And I have actually asked several times about trying to make sure that we have some support groups for our patients. And I believe there are some at behavioral health, but I really don't know how frequently they meet and how big those groups are. We have a geneticist who kind of coordinates a lot of that stuff, and we also have a breast navigator. And the breast navigator, along with the geneticist, help these patients who are recently diagnosed with breast cancer. They help them navigate the social and mental health issues of the disease a little more than I actually do once my part's a little bit done with the biopsy and talking with them about their diagnosis and getting them set up with a surgeon and that sort of stuff. Then we have other people who kind of direct them from there. But I do think that that's vital. And I think breast cancer is an overwhelming disease, and it does kind of that gift that tends to keep on giving even when you think you've gotten it beat. So
Absolutely.
it's better not to get that risk.
Yes. Well, Dr. Moss, before I let you go, I kind of just highlight some points that you want to make sure that our listeners understand, that they know how they can identify some risk factors, how, the detection and things of that matter. Just kind of a high point those for our listeners.
Sure. I think number one is for all women to consider having a risk assessment by the age of 30 to know when they should be screened. Screening for breast cancer is easy, it's safe, it's effective. And, for an average risk woman starting at the age of 40 and considering mammogram, it's a yearly thing you need to do. I think that is important. And I also think that we tend to minimize the fact that breast cancer can occur in younger women. As we talked about, 1 in 6 occur in women ages 40 to 49. And that just because you don't have a family member who has breast cancer, it doesn't mean that you're safe. Over 75 to 80% occur in patients with no family history and no genetic factors. So we just, it's being aware and knowing that you can't ever be low risk for breast cancer if you're female, hopefully will help people take it, seriously, and be sure to get their annual exams, do the things that they need to do to minimize their risks, and talk with one of us if they have questions or have an issue.
And absolutely. And how can they get in touch with you guys there in case they do need to talk to someone?
Okay, so the front desk at the Breast Care Center number is 662-377-4910.
Awesome. Well, Dr. Moss, I appreciate your time today. I know you're extremely busy, and thank you for everything that you and everyone over there on the Tupelo campus of the North Mississippi Medical Center at the Breast Care Center do to kind of make what is a very serious, very stressful time for a lot of people a little less scary. And I know that's tough because you've experienced personally. And again, thank you for all that y'all do.
Well, thank you, and thank you for helping us get this awareness heightened out there. I appreciate that.
And we'll be back with more of the ICC Hour right after this.
Playing on tour takes years of dedication, hours of practice, focused precision, and nerves of steel. That's how you become great at the game, but not how you should bank. That's why Allie Ewing chose Renaissance Bank. Their easy-to-use app makes banking a breeze, no matter where she is. Renaissance Bank, understanding you.
Hey Indian fans, I'm Ricky Murphy, real estate agent, Tommy Morgan Realtors, and I'm also a proud alumni of the All-American Marching Band. Itawamba Community College was my home for 2 years, and where you decide to make your home will be one of the most important decisions of your life. Whether you're looking to create a plan to buy your first home, or if you're ready today to make a move into your forever home, give me a call or send me a message so we can discuss your next move. And for my family,
Roll Tribe! Get a free extra most bestest pizza right now at littlecaesars.com.
Ding dong.
Order $15 or more for delivery and get a free extra most bestest pizza. Use code EXTRA PIZZA at Little Caesars.
Pizza, pizza.
Little Caesars new crazy calzone, julienne pepperoni. It's so tasty.
Garlic white sauce.
Here comes the bite. Here comes the...
Yummy!
Did I dream about the crazy calzone again?
You also said some weird things about giraffes.
We're not Big Pizza, we're Little Caesars. The new crazy calzone for $8.49.
Pizza, pizza.
Ever since we opened our doors in 1964, Davis Ford in Fulton has been committed to providing the highest level of customer service and customer satisfaction. That level of commitment is shown in our 18 Ford President's Awards for overall customer experience. Whether you're looking for a tune-up, a trade-in, or a new F-150, the team at Davis Ford is here to serve you. Come see us today in Fulton. Call us at 662-862-3711 or visit us online at davisfordsales.com. Davis Ford, small town dealership, small town prices.
High school seniors, make your plan to join us for Fall Preview Day at Itawamba Community College. Voted the #1 community college in the state 4 years in a row, come see what all ICC has to offer you and your future from faculty members within the program of your interest. Registration is open now for October the 21st and 22nd and November the 4th and 12th. Limited spots are available and they're filling up fast, so sign up today at iccms.edu/preview days. Itawamba Community College, the best start here.
They used to call me Sir Sauce back in the day.
I knew he was going to claim
Sir
that.
Sauce a lot.
You know.
Will is the sauciest.
Sauciest guy they know. Well, when I used to
kinda
date your
saucy at
auntie,
times.
she said I was saucy.
Sonic Crave Cheeseburger. You a saucy cat, man.
If I crave something, I have to have it.
So what are you craving? Like, what do you crave?
Attention, apparently. Look at him all sitting in the middle.
I know, right? It is really awkward. You just chose to sit there.
Sonic Crave Cheeseburger.
Why settle for a checking account that just holds your money? Renaissance Rewards Extra gives you so much more. Like savings at more than 400,000 retailers, 24/7 roadside assistance, a cell phone protection plan worth up to $400, $25 in ATM fee refunds per monthly cycle, and a great interest rate when you meet 3 easy qualifications. Get extra today at rewardsextra.com. Renaissance Bank, understanding you. Member FDIC.
My name's William Calloway. My father died when I was 11 and caused a lot of other deep-root issues in my life. I wanted to try college out when I got out of school, but then I ended up realizing like it wasn't for me. I felt like I needed to get out and get a job and at least do my part, you know. I wanted to help my mom with bills, being a single mother. You know, I just wanted to help. During these jobs, I had a void in my life I was trying to fill, and the only way I knew how to fill it was the use of my addiction. I experienced going to jail a few times, had to go to court for my son, and the judge gave me my final chance. During that rehab process, I got a call from my son, and that's where I knew I was headed down the right path. My mom told me about this class at ICC because she knew how much I enjoyed to cook. The food pathway course was tough, but my instructor helped me and kind of pushed me. And I'm thankful for Miss Christie for pushing me and motivating me to get through with that class. Because now I have a stable job in a positive environment and I enjoy going to work every single day. Building the best version of yourself won't happen overnight. It won't be easy. You will struggle. You'll want to give up. You have to surround yourself with positive people who encourage you and want to see you move forward. That's what you can expect to find at ICC in Belden, a place where you can build a better you.
My name is Emily Loden-Jones, and I am the instructor and the program director for the Forestry Technology program at Etowah Community College, and I have taught here for 15 years. Our students learn how to identify native hardwood species and softwood species in this area. They learn how to cruise timber and evaluate it for selling purposes. They also learn a lot about forest management regimes that we use to get specific objectives from our land. Our program will accept students either in the fall, the beginning of the fall semester in August, or in January, the start of the spring semester. This program is a 2-year program in which you will obtain an Associate's of Applied Sciences in Forestry Technology. It's also a transferable program to Mississippi State University in the College of Forest Resources. Most of our courses are taught in a traditional format because it is so outdoor based. We have one fully online class and one hybrid class. Freshmen attend 2 days a week for forestry courses, and sophomores attend 2 days a week for forestry courses. Our students usually obtain employment in either the state sectors or either in private sectors. A minimum starting salary would be, if you went to work for a state agency, of about $30,000 a year, and I would say most students would probably start around $36,000 to $40,000 a year. The best type of student for this program is one that does not mind being outdoors. It is hot, it is cold sometimes. They also need to understand that this is not just an outdoor program, but is a math, science heavy curriculum. Our one requirement is that you have a good pair of boots and some bug spray.
My name is Holly Wheaton, and I'm an early childhood education instructor and program director here at Itawamba Community College. Our early childhood education technology program is an engaging, superb 2-year program that prepares students for a professional career as early childhood educators across a variety of career paths.
The Early Childhood Program at ICC is a fully online program that educates students to work with young children. Even though it's an online program, students will spend 8 hours a week in childcare during their 2 practicum courses. We are aligned with national early childhood standards, and our students apply those as well as the Mississippi Early Learning Standards in their coursework. Throughout our online coursework, we offer a solid foundation on childhood development, theories, and practices. We focus on teaching students how to utilize an integrated approach while planning, preparing, implementing, and evaluating developmentally appropriate learning experiences that meet the diverse needs of children. The capstone courses are the 2 practicum courses. In these 2 courses, student teachers spend 8 hours a week in ICC's preschool classrooms or an approved center. During these 8 weekly hours, our students put into practice everything they've learned throughout the program, from classroom management to tending to the social and emotional needs of children. When they graduate with their AAS degree in early childhood from ICC, not only will they have a firm understanding of child development, but they will have a portfolio of developmentally appropriate activities ready to use in their own classrooms.
Our graduates of early childhood education receive an Associate of Applied Science degree. Upon receipt of that degree, they are ready and prepared to enter the workforce as teachers in public or private early childhood education centers, center directors, or even an assistant teacher in the public school system. Some of our graduates choose to go on to a university and continue their 2-year degree to earn a bachelor's degree. For example, some students go on and receive a Bachelor of Science in Early Childhood Development. This is especially beneficial if they wish to teach in Head Start. Lead teachers are required to have their bachelor's degree. Some of our graduates decide they want to go on and be an elementary education teacher, and they choose to get a Bachelor of Arts in Early Childhood Education or a Bachelor of Science in Elementary Education. So whether you choose to stop with an associate's degree or continue on to a bachelor's degree, we want you to get your start in early childhood education right here at Itawamba Community College. The best start here.
My name is Kent Lewis. I run the welding program here at ICC. If you're out there looking for a good career, don't know what you want to do, we can take you in 1 year and we can turn you into a welder. We start off learning how to stick weld, and we end up with TIG welding. When you leave here, you will have the skills necessary to be hired by a local manufacturing company or a construction company. Most start out at anywhere from $15 to $18 an hour and top out around $28 in this area. The industry is looking for people who don't mind getting out and getting dirty, hard workers, self-motivated. You've got to push yourself every day to be the best that you can be. It's a very physical job. It's hot during the summer, cold during the winter, but you get well compensated for that. The way I like to structure my class, I really like a lot of hands-on, getting dirty. In the morning times when you come in my class, we'll go to our welding booths and we'll practice our skills. After dinner, we focus a lot on projects. Just take, for instance, this box blade right here. It came in and it was tore all to pieces, and you can see now we've completely rebuilt it. It's ready to go back out and make a living again. As I told you in my introduction, I've been welding for 32 years. It's something that I get up every morning. I can't wait to get to work to strike an arc. It has provided very well for me and my family. I've raised 3 kids and paid a house off by getting out there every day. It's something that I enjoy doing. It's a skill that not everyone can do. And if you can master it, you can be very well paid.
Why settle for a checking account that just holds your money? Renaissance Rewards Extra gives you so much more. Like savings at more than 400,000 retailers, 24/7 roadside assistance, a cell phone protection plan worth up to $400, $25 in ATM fee refunds per monthly cycle, and a great interest rate when you meet 3 easy qualifications. Get extra today at rewardsextra.com. Renaissance Bank, understanding you. Member FDIC.
High school seniors, make your plan to join us for Fall Preview Day at Itawamba Community College. Voted the #1 community college in the state 4 years in a row, come see what all ICC has to offer you and your future from faculty members within the program of your interest. Registration is open now for October the 21st and 22nd and November the 4th and 12th. Limited spots are available and they're filling up fast, so sign up today at iccms.edu/preview days. Itawamba Community College, the best start here.
Ever since we opened our doors in 1964, Davis Ford in Fulton has been committed to providing the highest level of customer service and customer satisfaction. That level of commitment is shown in our 18 Ford President's Awards for overall customer experience. Whether you're looking for a tune-up, a trade-in, or a new F-150, the team at Davis Ford is here to serve you. Come see us today in Fulton. Call us at 662-862-3711 or visit us online at davisfordsales.com. Davis Ford, small-town dealership, small-town prices.
Everyone has a unique story to tell. Maybe your story has you performing your new song in front of a crowd, getting to play your favorite sport, or enjoying a horseback ride in the country. At Orthopedic Institute of North Mississippi, our group of skilled surgeons understand your need to continue your story. That is why we are the preferred choice for orthopedic care. Thank you for choosing us. Our story is you. Orthopedic Institute of North Mississippi.
And that's going to do it for this week's ICC Hour. Before we close out the show, I want to remind you that you can keep up with all things ICC by visiting iccms.edu or following Itawamba CC on your favorite social media platform. If you're interested in ICC athletics, you can visit letsgoicc.com to keep up with all 11 of our intercollegiate athletic programs, or you can follow Let's Go ICC once again on your favorite social media platform for in-game updates, links to videos, and so much more. Now, of course, we'd love to see you at one of our 3 locations in Fulton, Tupelo, or Belden, so set up an appointment to see how Itawamba Community College can help prepare you for a better tomorrow by visiting iccms.edu. Join us right back here next Tuesday at 1:06 for the ICC Hour presented by Renaissance Bank. I'm Adam Gore saying have a blessed week, and as always, roll Tribe.
So when are you going to give me back for the pizza?
Oh, personal foul. Let's give him a Renaissance replay. Make a successful handoff when you transfer funds to friends and family with Zelle and the Renaissance mobile app.
Here, you can be your best. The best train here. Learn here. Succeed here. Perform here. Win here. Thrive here. Itawamba Community College, the best.
Brought to you by Renaissance Bank, the bank that understands you. Learn more at renaissancebank.com.